Hello everybody, my name is Dr. Muhammad Khalid Hijazi from Syria. I'm a psychiatrist for more than 10 years, and in the latest years my focus of study was in neuropsychiatry, and I've got the doctorate from München University, which ranks 17th worldwide by number of Nobel Prize achieved. The results of my studies were shocking. Dopamine-related disorders differed from all our previous comprehensions, and unfortunately Parkinson's disease was shown to result from hyperdopaminergic activity and not by less dopaminergic activity. These astonishing results are very serious and will induce changes in neurology. Here I will give some of the main results. Parkinson's disease affects more commonly elderly. The classic presenting sign is resting tremor, and also rigidity and bradykinesia can be seen. The question here is why Parkinson's disease can have response to levodopa. If patient takes levodopa, that will increase dopaminergic activity in the brain, and the dopaminergic system will respond in a very unique process called compensation. This compensation decreases dopaminergic activity in the brain and causes improvement of symptoms. And such a way of treatment has been related to homeopathy, which assumed that increasing pathogens may cause some improvement of diseases. And now I'm showing some evidences that Parkinson's disease is caused by hyperdopaminergic activity. And in fact, there is no solid clue to make us think that Parkinson's disease is caused by lower dopaminergic activity as we now assume. Here are schematic figures of all findings on positron emission tomography. You can see that Parkinson's disease does not show one pathology of hyperdopaminergic activity, but in fact 3 pathologies. The 2 pathologies of increased dopamine synthesis and increased dopamine release are shared with schizophrenia and amphetamine abuse. Synthesis here is lined as red arrows, and dopamine is seen as the purple object. The 3rd decisive pathology is shared with chronic amphetamine abuse, and it is the chronic loss of dopamine transporters, which are shown here as gray arrows. Amphetamine is known to be one of the most potent dopamine releasers. For detailed discussion of the latest in dopamine-related disorders and for further evidences of hyperdopaminergic activity in Parkinson's disease, I'm very proud to introduce this book that can be ordered online. The book was printed under supervision of München University and Professor Norbert Müller, who supported and advised me throughout my studies.